the very first symptom I had was these violent seizures. And, if anyone saw them, they would say this is epilepsy. So epileptic seizures, these violent convulsions. If I was standing, I would fall down. If I was lying down, my body would be shaking. If I was holding something, my hands would, whatever I was holding would fall out of my hands. And then this would last, from maybe a minute, maybe 10 minutes. So, muscle spasms. But it would start off with this, what I call a storm in the brain, an electrical storm in the brain. And that's, I would actually see lightning in my brain. I would see this and I would feel it. That's what I liken it to. It's an electrical storm. Patches, bald patches on my scalp. Hair loss. This was the second symptom. So, it looked like alopecia. And there's a pattern, so there's 2 lesions here, 2 here, 2 behind the ears and 2 at the back of the head. So there's a clear pattern of the lesions. And then the hair loss, the hair thinning. I was weak, I was exhausted. My brain felt exhausted. I was lethargic, I felt very heavy, like I couldn't move. It was almost like, walking felt like I'm dragging my body in water. It just felt so heavy. So the constant fever, this was a low-grade fever, so in Celsius I would say it was about 38.5. I think that's about 101
I'm going to look
Fahrenheit.
that up.
I'm not sure.
Just to make sure.
So for most of the time, during these 18 years, it was a low-grade fever, but then it would flare up and it would last about 4 weeks.
Mm-hmm.
And it was, very, very high temperature to the point where I was, I would pass out and just end up in the hospital. They would basically give me injections to bring the temperature down. And, when I asked you...
Let's say, do you have any fevers now? Are you feeling better?
No.
Oh, no more fevers.
No, I have not been bedridden since I started treatment with you. I'm up and about. I can go all day.
Gail, I want to make a point with people here. On a scale of 0 to 10, if 10 is the worst, fatigue, 10 is the worst level it could be. You said it was what level? 12. So it was worse.
It was 12.
Worse than the worst. And now it's been at what level is your energy now? So again, fatigue, let me put it in the same range of fatigue, 0 to 10 is your 12, you're worse. What is the level that you're at now?
3.
3. And that has been a pretty constant, consistent level of fatigue for you.
Yes.
So we're looking at even better than 70 to 80% improvement in the energy level of your body.
So I have not had fever since the end of the second protocol.
Okay.
That was May of this year, 2019.
Excellent.
Improved digestion. I had gastrointestinal issues also accompanying all this, what we've mentioned. So for the 18 years, I had, severe bloating. I had either it was constipation or it was diarrhea. It was one of the two. I had these, issues with digestion, so much bloating.
I remember you coming here. You had this chronic cough that was not stopping.
Yeah.
How long did you have coughing for?
6 months. I was coughing nonstop, every day, all night.
So now the coughing is totally gone.
Completely gone. Completely cleared.
It's been gone for how long?
It stopped at the end of the first protocol. It was completely cleared.
Mm-hmm. Yes.
Yeah.
Has that been good?
I had a lot of swelling in the hands and the ankles, the feet, the legs, lower legs. That's gone.
That's
completely
totally fine.
fine.
And I think since I see here in my notes, that was from November, I got that note from you, November of 2018. So we're looking at about 10 months, no more swelling in the feet and ankles. How long did you suffer the swelling in the feet, hands, and ankles? How long was that going on in your life prior to coming?
Again, the 18 years, it was when the whole thing started, with the seizures and the fever. And this was since childhood. If we were on a flight for maybe 7-8 hours, I would be vomiting for most of that time. And then once I'd vomited the contents of my stomach, I was vomiting just nothing. I was it was crazy. It was crazy.
And that was a constant for you for years, and that's no more.
That's no more.
No more.
No. Nope.
And how long did that spine pain exist in your life for? How severe was it, and how long did you exist with that? Did that exist with you, I should say?
Yeah, it started when the seizure started. So again, 18 years, and I had pain not only in the spine but throughout the body. So literally from head to toe. Yeah.
And now is that spine pain, or that head to toe pain that you're describing from the seizures, that whole incident, is that gone as well?
It's gone completely.
Completely gone. Today we're on a call with Shifa Al-Qasim, who's in United Kingdom, who comes to my clinic in Florida, in the United States, for her lupus condition, as well as chronic fatigue, as well, which she'll be explaining in a little bit, as well as chronic fatigue. And she had for about 18 years, she had a fever that was nonstop, and she had seizures that had been going on for many years. So today we're just going to share some update on how better she's doing with this unique work that I offer. And the point of this is to help you understand that you too can get better. And yes, I'm here to help you. And yes, I'm here to tell you that it is service in my clinic that you have to come for. So we are looking to help you get better and provide service for you and to you and with you, and help you overcome your lupus condition. What most people don't know about lupus and about other health, chronic health conditions, is that there are chronic hidden infections and chronic hidden toxins that are in these tissues that are making the body diseased, that make different types of symptoms occur. So while she is not totally recovered yet, we're making a big difference in her life and helping her feel and function a lot better. So if I can ask you, I noticed that I saw a comment that you put on one of my YouTube videos, which I'll put up here on the screen as well in a little bit. You said that you were feeling about 80% better overall. So if you can describe to some people here who are listening to you, who also want to get better, they're also suffering, and you know what it's like to suffer. Before we get to the 80% better, how bad was it for you over the past 18 or so years? If you can list some symptoms down of what you were dealing with.
Okay, so the very first symptom I had was these violent seizures. And, you know, if anyone saw them, they would say this is epilepsy. So epileptic seizures, you know, these violent convulsions. If I was standing, I would fall down. You know, if I was lying down, my body would be shaking. If I was holding something, my hands would, you know, whatever I was holding would fall out of my hands. And then this would last, you know, from maybe a minute, maybe 10 minutes. So, you know, muscle spasms. But it would start off with this, what I call a storm in the brain, an electrical storm in the brain. And that's, you know, I would actually see lightning in my brain. I would see this and I would feel it. That's what I liken it to. It's an electrical storm. So I would feel that in my head. And then following that, I would have movements in my limbs. So the arms, the legs, the whole body. Following the seizures, I noticed there was some itching in my scalp. And then a few months later, I noticed patches, bald patches on my scalp, hair loss. This was the second symptom. So, you know, it looked like alopecia. And there's a pattern, you know, so there's two lesions here, two behind the ears, and two at the back of the head. So there's a clear pattern of the lesions. And then the hair loss, the hair thinning, and then the fatigue. So following the seizure, I would want to sleep, and I just wanted to sleep all the time, like all the time.
Mm-hmm. Like all day. You just wanted to
all
rest.
Day.
All day.
Yeah, I was drowsy. I was weak. I was exhausted. My brain felt exhausted. I was lethargic. I felt very heavy, like I couldn't move. It was almost like, you know, walking felt like I'm dragging my body through in water. It just felt so heavy. And a lot of the time I didn't feel fully awake. So, you know, I decided to write a book. When I sat down to write this book about my experience with lupus, I realized that I couldn't actually remember most or a lot of what I was feeling and thinking at the time. At the time I was having the seizures, at the time I had the fever. So the fever was accompanying the seizures. You know, I was warm, my body was heating up. Yeah, so these were the major symptoms and the first symptoms that I noticed.
And how long did the fevers last for? You told me it was a pretty long time in your life. It was constant fever. And how long was that?
So the constant fever, this was a low-grade fever, you know, so in Celsius, I would say it was about 38.5. I think that's about 101
I'm going to look
Fahrenheit.
that up.
I'm not sure.
Just make sure.
So for most of the time, during these 18 years, it was a low-grade fever, but then it would flare up and it would last about 4 weeks.
Mm-hmm.
And it was, you know, very, very high temperature to the point where I was, you know, I would pass out and just ended up in the hospital. They would basically give me injections to bring the temperature down. And, you know, when I asked them what they thought was going on with me, they would say was it seemed like it's a virus, a viral infection, things like this. And it would last 4 weeks. So, you know, I was taking antibiotics, a 2-week course of antibiotics, and then another 2-week course of antibiotics.
And it never really resolved the fever situation because you stayed in a low-grade fever all the time, 18 years.
Yeah.
When was that? And now after just 2 protocols with me and removing, if I can say here, we had the root canal removed that you had for several years. How much better for temperature-wise does your body feel?
I would say...
Let's say, do you have any fevers now? Do you feeling better?
No.
Oh, no more fevers.
No, I have not been bedridden since I started treatment with you. You know, I'm up and about. I can go all day. Sometimes I don't know when to stop. You know, I'll just keep going and I'll make myself tired. And I need to learn. You know, I don't know when to stop. I need to learn how to do that.
Why? There's no. You know, it's good, but you're still, because right now you're looking at, before you came to me, your fatigue level, as you just said, it was crushing. It was so, you were so lethargic, you were bedridden, you could barely get up, like walking through water is the description that you just gave. It was so heavy, your body was so heavy, it was so hard to get around. So on a scale, I want to make a point with people here, on a scale of 0 to 10, if 10 is the worst, fatigue, 10 is the worst level it could be. You said it was what level?
12.
12. So it was worse.
It was 12.
Worse than the worst. And now it's been, at what level is your energy now? So again, fatigue, let me put it in the same range of fatigue, 0 to 10. You're 12, you're worse. What is the level that you're at now?
3.
3. And that has been a pretty constant, consistent level of fatigue for you.
Yeah.
So we're looking at even better than 70 to 80% improvement in the energy level of your body. But I will tell you that there's still infections that we have to go after. I'm going to be listing, with your permission, I'm going to list some infections that we found in the past 2 rounds with you, and the root canal that was extracted. So this is all making a big difference, because when we remove the different infections that we found, and we remove the root canal, which is a dead infected tooth from the body, even though that wasn't the first cause of your whole situation, and I'll describe more about it in another video that I'm going to follow up about this, to attach to this video that you're giving us right now. And thank you for your generosity and your time to help us share this with people. And the fevers are gone. How long? When was the last time you actually had that low grade temperature? And you've been with me. Let me just say, we started together August of 2018. You had your first exam and protocol from August of 2018. You had your second one November 27th of 2018. And we're filming this in September, mid-September of 2019. With those 2 protocols that you followed, when was the last time that you had the fever? And again, we started 11 months ago.
So I have not had fever since the end of the second protocol.
Okay.
That was May of this year, 2019.
Excellent.
Throughout both protocols, I had fever and I had so many symptoms. Whilst taking the remedies, I had a lot of symptoms, and I wrote them down every day. Mm-hmm. But after completing 2 protocols, I have not had seizures, and I have not had the fever.
And what about that's excellent. So let's just say that's excellent. I applaud you. I'm glad for you. I'm happy for you. It's exciting.
You.
And I'm going to say two things. Number one is, when you're going through a protocol and you're taking these remedies to tag to get your body to find that infection that we targeted with a remedy that we found in this unique exam process, to find it and get rid of it, your body is going to have some more inflammation in the infection fighting and removal process. So there are times that people like you can have aggravations in the true healing process. When it's true healing, we can have flare-ups on the skin, we can have a back pain, you can have sweats in the bed, you can have a headache, you can have a number of things. So
Yeah.
That's a common. When you're better, what about the electrical shock kind of sensation that you say it was like I think you've told me it was like seeing lightning or like an electric shock in your brain that you can actually see it and feel it and through the body. Has that occurred in the past few months at all?
Nope.
No.
Not even once.
Beautiful. Okay. What are some other symptoms? Because I think that you had written down that you're about 80% better. So is there more to it than the energy improvement, which is phenomenal? Everybody needs more energy, so that's excellent. Now you can get up out of bed, you can walk, you're not bedridden anymore, and there's no more fever and there's no more seizure activity. What is there something else that you've experienced with this care in the 2 rounds or the improvement from this care in the 2 rounds that you can share?
Yes, I have improved digestion. I had gastrointestinal issues also accompanying all this, what we've mentioned. So for the 18 years, I had, severe bloating. I had either it was constipation or it was diarrhea. It was one of the two. I had these, issues with digestion. I had so much bloating. And I also had a lot of weight loss. I lost 10 kgs. Mm-hmm. And I was eating okay. In fact, I was eating probably 4 times the amount I would usually eat. But despite all this eating, I was losing weight. I was shrinking. And it was very scary for my friends and family to see, and for myself. I could count my ribs. I was just bones. It was pretty severe. Yeah.
And now, so how much have you put back on?
I have put, I do this in stones. I think 2 stones.
Well, you put a lot of weight back on. Not a lot, but you put weight back on that you feel healthier. You feel stronger.
Yes.
And it's not looking
at bones.
You're not looking at bones on the, coming through, your ribs coming through.
So the inflammation of the skin that I had, it's not as severe as it was.
What about the respiratory? I remember you coming here. You had this chronic cough that was not stopping.
Yeah.
How long did you have coughing for?
6 months. I was coughing nonstop, every day, all night. And at first, it was, my family thought maybe it's TB, tuberculosis, because a lot of people in my family have had TB. Mm-hmm. So we assumed that it's that. And I had some X-rays, I had some tests, and at the hospital, there was no TB showing in any of the X-rays. And after I saw you told me I had 2 lung infections.
Right. I found mold. I see. Yes. Looking at your protocol, I found 1, 2, 3 molds. I found some dust, house dust particles affecting your lungs, and scabies infection affecting your lungs. And that might have been it in there. Yeah. So now the coughing is totally gone.
Completely gone. Completely cleared.
It's been gone for how long?
It stopped at the end of the first protocol. It was completely cleared.
Mm-hmm. Okay, so we're looking at probably around, let's just say maybe around December of 18, sometime around there. So it's been about 9 months or so. You have not had any coughing, which is wonderful. There was something else you said that you used to, if I can bring up something else here, you said that you have had in the past swelling in the ankles, swelling in the hands.
Yeah.
Has that
I
been
had,
gone?
I had a lot of swelling in the hands and the ankles, the feet, the legs, lower legs. That's gone. It's
That's totally
completely
gone.
fine.
And I think since I see here in my notes, that was from November, I got that note from you, November of 2018. So we're looking at about 10 months, no more swelling in the feet and ankles. How long did you suffer the swelling in the feet, hands, and ankles? How long was that going on in your life prior to coming?
Again, the 18 years, it was when the whole thing started, with the seizures and the fever and the weight loss. I had the swelling.
Mm-hmm. You used to get sick on plane flights. You used to, right?
Yeah.
We're talking about stomach.
Always. This was since childhood. If we were on a flight for maybe 7-8 hours, I would be vomiting for most of that time. And then once I vomited the contents of my stomach, I was vomiting just nothing. It was crazy. It was crazy.
And that was a constant for you for years, and that's no more.
That's no more.
No more.
No. Nope.
I'm going to give you what we call in the United States a high five.
High five.
You also told me that you had spine pain. There was constant spine pain.
Yes.
And how long did that spine pain exist in your life for? How severe was it, and how long did you exist with that? Did that exist with you, I should say?
Yeah, it started when the seizure started. So again, 18 years, and I had pain not only in the spine but throughout the body. So literally from head to toe.
Mm-hmm.
Yeah.
And now is that spine pain or that head to toe pain that you're describing from the seizures, that whole incident, is that gone as well?
It's gone completely.
Completely gone. And the doctors who saw you in the past before coming to me, those doctors, did they, when they were, you were seeing them for any answers about the spine pain, about the swelling in the ankles, hands, feet, about the fevers, about the fatigue, about the weakness in the body, about the chronic cough, did they ever give you any real, besides giving you an antibiotic, which, by the way, you said before they thought it was viral and they gave you antibiotics and you're on 2 weeks on and off of antibiotics. Antibiotics don't kill viruses. So right. That's really an odd, and that they do that here in the U.S. They do that in any country as well. So it's not just where you're living or where, I mean, it's just
yes,
not affecting the viruses. But did they ever give you any other kind of strategy, any other kind of test that actually proved that why you were suffering, besides calling it lupus? And I understand lupus. I'm going to describe a bit more about that in a follow-up video that I'll make with this. So is there anything that they said? Did they just say, like, that's lupus causing it? Or did they say, well, we know there's this infection or this virus? Did they ever say anything like that to you? No.
No.
There's really there was no great proactive step.
No.
Did you also have foggy brain? Was that a problem before?
I had some memory problems. Yeah, I had some memory problems. I think I'm okay now. I don't know if no, I don't seem to have any problems now.
Okay. Excellent. And you also said you had symptoms during your female cycle, during the monthly cycle. They're really bad symptoms. Are those still existing, or is that gone?
No, they're completely gone.
That's completely gone. How severe were those female monthly symptoms for you? When I say severe, it was obviously for you to tell me about it. It must have been bad enough. So, I mean, was it something that was only within a few days of having your cycle, to have, excuse me, I'm going to be very straightforward, to have the bleeding? Was it in a few days of like a premenstrual that you felt, or was it all throughout the month, or was it, within a week or two before the bleeding and after the bleeding?
It was mostly, it was premenstrual. So about, 10 days before the bleeding started. 10 days. I would be feeling exhausted. I would have a lower back pain, fatigue, just feeling really tired all the time. And then I would be moody and I would be very irritable. I would get angry. Yeah, that was basically.
Those symptoms, are those PMS, that whole 10 days is that none of that's occurring?
I would say out of 10 now, 10 being the worst, it's maybe 1 now.
1. And you still feel that for a full 10 days, or do you feel that for a shorter period of time at a 1?
For about 5 days now.
Congratulations. And the anger that accompanied all of that, does that come up still? Or is that gone?
I would say, again, out of 10, it's now 1.
Okay.
10 being the worst.
All right. So we still have a little more to do, but that's, I mean, just incredibly, incredible results. I want to go back to one more point about the bowels. You had, it was an alternating constipation, diarrhea, and bloating. And was the bloating a constant throughout every month, every day?
I had the bloating, yeah, for most of the time. I was, I mean, every time I ate something, I was bloated. But even when I wasn't eating, I was bloated.
And even without eating, so it wasn't just food brought on the bloating. The bloating was there even when you didn't eat meals for, let's say, a few hours. You'd still feel bloated. Yeah. And it was alternating. And so I'm going to use a term called irritable bowel syndrome. There was bloating, there was constipation and diarrhea. So it alternated all the time. When was the last time you've had this irritable bowel, this bloating and alternating constipation, diarrhea? How long did it stop? Yeah,
so I'd say 9 months now. I mean, before I started the treatment with you, I haven't had these issues since completing the 2 protocols.
Okay, excellent, phenomenal. Now I am going to, with your permission, is there anything else that you want to share with anybody before I come to the other? Did you, one more thing, there were symptoms, excuse me, I'm sorry, I'm looking through, there was a long list. When you presented everything to me in a letter that you sent me before coming to me, there was a long list of symptoms, yes? A very long, right? And yes. So there's been 18 years of suffering, even since you were a child, you had the vomiting from the airplane flight. So there was something else that you had told me, there was night sweats. That was a pretty regular situation for you. Are you still getting those night sweats?
No. No. The night sweats happen during fever. Yeah, it was during the fever.
I mean, go down a list. I'm sorry, there's so many here. So you also had occasional sharp pains in the chest.
Yeah.
Are those occurring anymore?
Nope.
You said in here you needed your arms, back, shoulders, neck, and head to be massaged every night and every morning due to stiffness and discomfort. Is that still
Absolutely?
Is that still something that needs to be done?
Nope.
No more. Really?
Nope.
You didn't tell me that before.
Maybe once in a while. But I think most people need that once in a while.
Yeah, but that's not. What about the difficulty swallowing? You said your throat feels like it felt like something was stuck in your throat. Is that still going on?
Yeah, I still feel this. I feel like my throat, I have vocal fatigue. My throat feels very tight.
Okay. So we still have a few symptoms of the irritations with the gums, right? We still have the scalp irritation. We still have the nose bleeding sometimes that's happening, and we still have the throat irritation. So that we still have some things to go after. Healing doesn't always happen overnight for anybody listening to this. It's not just an overnight success and a miracle that we're doing here. We're peeling away the layers of the different infections in different tissues of the body. Again, I will point that out in another follow-up video. One other symptom, and then I can let you go. You said that you were sensitive to the bright lights. Is that still a symptom that you feel? Is there a light sensitivity?
Not as severe.
Okay.
Yeah.
Okay. So is there anything else that you want to add for anybody who's listening to this who was in a place like you, because you lived a very hard time? I remember meeting you first, how stressed you appeared when I first met with you in my clinic. And again, the long letter that you sent me with all the different symptoms of how bad it was to be with this lupus and with everything that you were dealing with. And when you had found me, or your brother had found me online, watching my information about what I do with people and for people, and you needed to build some trust. You needed to be able to build up some faith that somebody can actually help you after many years of debilitating symptoms. Is there anything that you can tell anybody now who's listening to this, who has some hope, who's looking for answers? Who's been to many different doctors and tried many different things? Is there anything that you can share with them about what you think, about coming here?
I would say to people, I've been saying to people, don't waste time. Go and see Dr. Herman. when I was diagnosed with lupus, and I was told that this is your body attacking itself, as they say, I didn't believe that. I don't believe the body attacked itself. I think that the body is constantly, it's designed to fix itself and to preserve itself. And within my body, I felt like my body is attacking something that should not be there. This is what I believed, and this is how I felt within myself, that there's something in my body which shouldn't be there. And so this is the immune response. This is why I'm having this hair loss and the seizures, and my body is going after something, and I need to get this, whatever this is, out of my system. This is what I believed. And I didn't find anybody throughout my research online, mostly, who believed what I believed. And this is the reason for why I came to you. I saw you, I visited you, was because you were saying that illness, sickness occurs when there's something in the body that needs to be removed. And surely enough, that's what we found. That's what you found. And this is why I decided to visit you.
So for anybody else out there, the job that we have to do is to find, pinpoint, and safely remove the hidden infections that are in the tissues, whether it's in your brain, it's in your bloodstream, in the stem cells in your bone marrow, your cartilage, your liver, your pancreas, your spine, your anywhere, your respiratory system. I practice a unique system and I'm diligent enough to realize that there's always something to learn, and humble enough, I should say, always something to learn, but diligent enough to help you weed through the layers of these connective tissue diseases, of these autoimmune diseases. As she said, the body's not attacking itself. The body wants to get rid of something, and there's inflammation going on. The immune system is trying to do that. So I want to thank you for your generosity and time to help share this with people and spend this time with me today. I really appreciate it because if we can help one more person at least get the amount of improvement that you've experienced, and I plan on doing a lot more for you and with you. But I think that's another person. You're welcome. When we can get another person better, that's what it's all about. That's what it's all about. So.